Hello, my name is Michalina Lewicka-Yamin, and I will continue the intellectual property strategy of Remicadem. Biomarkers are measurable indicator of the severity of presence of some disease state. We can classify them into two groups. First one, imaging biomarkers, such as computer tomography, magnetic resonance imaging, or positron emission tomography. Second one, molecular biomarkers, such as biological samples, blood, serum, urine, nucleic acids. Here we include a single polymorphism or mutations, proteins, lipids, peptides, or small molecules. The other classification of biomarker could be based on application for diagnostic, stage of disease, disease prognosis, on monitoring of clinical response. This figure presents biomarkers classification for rheumatoid arthritis. Authors of the publication claim that molecular biomarkers, or biochemical markers as they name it, are the most significant and helpful for assessing at different stages of the disease. Here, I would like to present some biomarkers that reinforce infliximab patent, especially the one for chronic disease. I would like to focus on this research because that was a collaboration between a research hospital in Canada and States, as well as Johnson Pharmaceutical Research and Developmental Team, that shows that infliximab therapy is associated with a decreased activity of tumor necrosis factor and activity of influence growth velocity as well as bone density and structure in children with a chronic disease. Remicade is a leading drug on the market since many years. Johnson & Johnson over that time was involved in several infringements of its product. I would like to mention a few here. Johnson & Johnson sued Abbott Laboratories for patent infringements and won at the first court, the largest patent infringement verdict in American history. However, the verdict was reversed in 2012 by Supreme Court, claiming that Abbott Laboratories' Humira arthritis drug did not infringe a patent owned by Johnson & Johnson. After merge of Merck and Sherings, they had a dispute with Johnson & Johnson considering the distribution of Remicade, and in 2011 they reached arbitration, and now the Merck is distributing the product in Europe. In 2014, Celltrion, which is a Korean company, claimed a lawsuit against Johnson & Johnson, reminding that patents are invalid and unenforceable. However, they lost. In 2004, Johnson & Johnson had a sue against Celtic Therapeutics Limited that was trying to release on the market a drug by the name of Humira, and the name is substantially similar in appearance to the product produced by Johnson. In 2006, Johnson & Johnson was found guilty for covering up of its side effects and risk of its drugs.